Respirators and surgical masks are two types of personal protective equipment, or PPE, that are used to protect workers in healthcare settings. A surgical mask is not a respirator, and that's an important distinction for you and your employer to understand. So let's review the significant differences between a respirator and a surgical mask. What is a respirator? A respirator is a type of personal protective equipment designed to reduce your exposure to airborne contaminants. Respirators are available in different types and sizes, and the respirator you use must be individually selected to fit your face and to provide a tight seal. A proper seal between your face and the respirator forces inhaled air to be pulled through the respirator's filter material and not through gaps between your face and the respirator. If your supervisor requires you to use a respirator, it must be NIOSH certified and must be used in the context of a comprehensive respiratory protection program according to OSHA's Respiratory Protection Standard 29 CFR 1910.134, which includes but is not limited to medical evaluation, fit testing, and training elements. Respirators are used routinely to protect healthcare workers against airborne infectious diseases, such as tuberculosis, anthrax, SARS, and hantavirus, because they protect against both large and small particles. What is a face mask? A face mask is a loose-fitting, disposable mask that covers your nose and mouth. Surgical masks, dental masks, medical procedure masks, isolation masks, and laser masks are all types of face masks. Face masks help stop large droplets from being spread by the person wearing them, whether that person is a patient or a healthcare worker. Face masks also keep splashes or sprays from reaching the mouth and nose of the person wearing them. However, face masks are not designed or certified to seal tightly against your face or to prevent the inhalation of small airborne contaminants. During inhalation, small airborne contaminants pass through gaps between the face and the face mask and the material of the mask. Remember, face masks are not considered respirators and they do not provide respiratory protection. Only face masks that are cleared by the U.S. Food and Drug Administration, the FDA for short, may be legally marketed in the United States. The FDA approval signifies that they have been tested for their ability to resist splashes of blood and other body fluids. To offer protection, both face masks and respirators need to be worn correctly and consistently throughout the time they are being used. When used properly, face masks and respirators both play an important role in preventing exposures to different types of hazards. If you need the protection of both a face mask and a respirator, you can use a surgical N95 respirator. Surgical N95 respirators offer protection from both airborne and body fluid contaminants and are approved by both NIOSH and the FDA. During an infectious disease outbreak, such as SARS or pandemic flu, face masks and respirators should be used in conjunction with other controls and interventions that are known to prevent the spread of infection. These include engineering and administrative controls, such as installing sneeze guards and permitting teleworking, and work practices such as cough etiquette, hand hygiene, and avoiding large gatherings. For additional information on respiratory protection in the workplace, consult this website.